So next up is Wellcare. I'll let Jamie introduce the team.
Thanks for the clap. Hi everybody. My name is Jamie Custelut. Hopefully you know me. I'm one of the regional agency managers for the state of Michigan. I've been with Meridian, Wellcare, Centene for about 4 years now. I've been on the sales side for about 3 years. And just the more I'm here, the more I love it. Please use us as a resource, and I'll let them introduce themselves before I go into my okay.
We're scared of each other. Good afternoon, everybody. My name is Shayna Ramon. I work with the national sales team with Wellcare. I was a regional agency manager for New Mexico for 3 years and recently transitioned into this role. So I'm excited to be working with diversity as a whole, and I look forward to supporting you. Thank you for having me today.
Hi everyone, my name is Kevin Crutter. I'm a regional agency manager along with Jamie. So we are your points of contact for Michigan. We divide and conquer the state, so please reach out to both of us if we can support you. I feel like I've met a fair amount of folks in here, but still need to meet the rest of you. So please introduce yourself, I'll be outside, and thanks for having us.
All right, before I go into it, I didn't collect any raffle, here, let me see this. I didn't collect any business cards because I wanted to ask, who knows the state we're expanding into this year, in 2025?
Iowa.
Who said that first? You're, okay, I'll get you one. I'll get you one. There you go. All right. 4. So I know I'm the last one between you guys, and they've talked about a lot of stuff with the industry, so I'm really just going to stick to Wellcare. If I'm saying something that doesn't make sense, please let me know. But starting out, so with Wellcare, we are underneath the parent company of Centene. Centene is a Fortune 500 company. In 2024, we were listed as number 22. So we've gone up and down a little bit the past few years, but still going really strong. We have over 28.5 million managed care members across the country. And that's in all lines of businesses, not just our Medicare and Medicaid. But one thing on this slide I'd just like to point out is that we serve every 1 in 15 individuals across the country that we touch. So somewhere, 1 in 15 people is connected to Centene, whether that's PDP, MAPD, Medicaid, stuff like that. So we are a big company, but especially here locally, I really value on being local, being down on the ground. You know, we're a corporation, but you know me, I'm not corporate at all. So I'll jump right into Michigan. So, wanted to just give you the idea, just the lines of businesses. Most of you know this already, but on the far right side, you'll see in Michigan, we have Meridian. This is our state Medicaid system. So if anybody has Meridian, they are a part of this Centene company. The middle there is Wellcare. That is going to be, of course, your Medicare, Medicare Advantage, and PDP plans. And then on the far left, we have Ambetter. That is our under 65 marketplace. So if you see Ambetter from Meridian, just know that that is under 65. But that's our brand here in Michigan. A couple things to highlight. So we do have a new low premium open PPO plan coming into 2025. We have a low premium HMO POS that has high enrollment in there, really decent supplemental benefits. So wanted to introduce a PPO, give people more options to go out and network. Our DSNP plans for our Wellcare Spendables card will have a monthly allowance, and it does roll over month. So I'll talk about Spendables in a little bit. Our non-DSNP plans for the Spendables card, it'll be a quarterly allowance, and that does not roll over. They'd have to use it or lose it. And then lastly, we are the preferred Medicare Advantage provider for the American Legion. So when you look at our Patriot Give Back plan, our open MA only plan, you'll definitely see reduced cost sharing for mental health services, psychiatric services, and just in that veteran community. So if you're interested in that, we'll definitely have a conversation. But Key things, please listen to this. Wellcare Complete. Wellcare Complete is going away. There's 3 plans. We have a Wellcare Complete, Wellcare Complete no premium HMO, a Wellcare Complete give back HMO, and a Wellcare Complete dual access HMO DSNP. So this was under the Ascension Complete network. It moved over, it's Wellcare by Allwell. So in Michigan, those 3 plans are going away. They're terminating at the end of the year, they're not rolling over, so members need to actively choose a plan during AEP to make sure they have coverage. So no crosswalking or anything. So, yeah, I know it's not the best, but really just condensing that portfolio, yeah.
So if we have clients in these plans, can we let them know now, before October 1st, or do we have to wait till October 1st to let them know?
Yeah, no, you have to wait. So you would have to wait until October 1st, but if a member comes to you with their ANOC, when they get that, they're coming to you and that's a different conversation. But no, I would say right now, figure out the members that you do have and make sure they're the ones on the top of your list to reach out to.
And actually, Jamie, I do want to point out, when there is a plan termination, it gives them an election period through the end of the year. So you don't have to rush to get them into a plan during AEP. You can still assist them December 8th through the 31st for January 1 effectives, because it is a plan termination.
I feel like I should have known that, but thanks, Stephanie. Awesome. So yeah, those 3 plans are going away. If you see Wellcare Complete, they're going away. Last thing on the bottom here, there's no plan change per se, but our all dual assured, that is our partial DSNP plan that we have right now in 2025. So on the far left, you see those MSP levels. Those are all the MSP levels currently accepted by the partial dual plan. But you can see FBDE, Quimby Plus, Slim B Plus, and Quimby only. Those are in that partial dual plan, which it doesn't really make sense for members to be fully dual and in a partial dual. So going into next year, any member who has FBDE, Quimby Plus, Slim B Plus, or Quimby only on that partial dual plan will crosswalk to our Wellcare Dual Access HMO POS DSNP plan. Only those MSP levels. The remaining ones, Slim B only, QDWI and QI, they'll remain in that partial dual plan. The only difference is there's just a plan name change. So it's now called the Dual Reserve. And that you'll see that on that slide there, but that's just to kind of even out the MSP levels, make sure people are coordinated with the appropriate plan. Okay. So, Iowa is our expansion state for 2025. We do have, how many states does it say? 32, I was going to say 31. So 32 states across the country, of course we're in Michigan here, but just wanted to give you an idea on that. Also, this is also really important too. So across the country, we are doing a name change for some of the plans. Don't worry when I start saying this, because it doesn't really affect Michigan to a degree, but some plans across the country are called Wellcare No Premiums, HMO POS, or PPO. That, when we rebid and reallocated for 2025, some of those plans did have to have a premium on them. So as a whole, we don't want to market plans as Wellcare No Premium. So they changed it to Wellcare Simple. So if you see a Wellcare Simple, that was previously called a no premium plan. However, it doesn't automatically assume that there's going to be a no premium. But what I said is, however, in Michigan, our plans for these are still no premium. But just know across the country, it could be different. So that's just the general name change there. All right. Oh, I don't like this slide, but so unfortunately for 2025, Michigan is moving to being an SSBCI state. So what that means is right now in 2024, we have a VBID contract, which is your value-based insurance design model, where members automatically get the healthy food benefit, automatically get the $0 prescription drugs. So Michigan didn't qualify, we're automatically going to be an SSBCI state. So what that means is that members, to be eligible, to be in the DSNP plan and get those extra benefits, they would have to qualify. So right now, members, I'm going to skip back to this slide because this makes more sense. So right now in 2024, the way members qualify is that they must have 3 or more ER visits, or 2 inpatient stays within the last 60 days. The chronic conditions list is fairly low. And members, if they were auto-qualified, they weren't notified until December. So that was kind of a hard thing to have. So going into 2025, the criteria, which I'm gonna go back to this one so you can see here. The patient, I'll go back. The patient must require intensive care management, and so the member has to have had 1 or more inpatient admission or emergency room visit in the last 12 months. Does that seem a little easier? To kind of, so it's not in 60 days. Second, members identified as high risk for unplanned hospitalization, and then they have to have a qualifying chronic condition. So, I listed up there those chronic conditions. If you want, please take a picture. These is what's listed as the qualifying condition, so it is more than just your typical ones. Members who automatically qualify this year, so if you have a D-SNP member right now, they're going to get sent their ANOC for changes coming for the new year. If they auto-qualify for SSBCI, and again, that's because Wellcare identifies them based on historical data claims and stuff like that, they'll be notified with their ANOC saying, hey, you are eligible for these benefits. Because some people can still enroll in these D-SNP plans, but they wouldn't necessarily get the food benefit, they would just have OTC. They may have co-pays on their drugs, so that's a very unfortunate change. But that's the way that we're going for 2025. Yes. So if they don't qualify for SSBCI, which gives them the fully covered drugs, they would have, a certain level of LIS, and so they would have to pay at most, I believe, $12.50 for drugs. If they don't qualify. So. Yeah, it's just Wellcare. Yeah. So some of our other states will have even contracts. Michigan unfortunately does not. So I'm irritated. I know you probably are too. But we're gonna get through this. It's gonna be good. I need to make money. You need to make money. Yeah.
So that means if we have somebody that's on a D-SNP plan now, going into 25, they have to have a chronic condition, qualify for the extra benefits like deductibles?
Correct.
Plus the hospital, plus
So David was just asking that if you have a member right now in a D-SNP plan, going into 2025, would they have to have a qualifying chronic condition to get the extra stuff? So the thing is they can still stay in the plan, and maybe this will make more sense when I have the plan up, but they still can stay in the plan. But to get, being able to use not just the spendables for OTC, to get all the extra stuff, they would have to qualify for SSBCI. So members currently in the D-SNP plans could be automatically qualified because of our past data, knowing that they have certain things. They would be notified in late September. If not, there is a website that the provider goes to that it's an attestation. It's fairly easy, and that's usually communicated. That's in like their enrollment guides when they get enrolled in the plan. So,
Got a question. So if they don't qualify for that, when will we know? When will they know if they don't qualify? And will they get something in the mail letting them know they don't qualify for that benefit?
10 days they'll get either acceptance or rejected. If they do get rejected per se, there is an appeals process that they can go through. But within 10 days is when the decision is made.
Within 10 days of what?
Our existing
Talk about our existing, when do they get it?
Oh, existing people will get notified with their ANOCs in September.
What happens with the food, the dad, the OTC, the card for everything was in OTC?
Correct.
And then what else?
It's just the drug co-pays.
And then her cookies.
They could, yeah. Yeah, Maureen?
So will we also be notified of the members that will be going through this process or not?
Yeah, that's what I need to figure out.
Okay, because not everybody reads their ANOC.
Oh, yeah.
And then at some point, they're gonna, probably the first of the year when the change happens,
Try to use that and
try to
then,
use it and it's not gonna be there, and now they'll have, have to be moved or whatever. So again, we should be, it would be
Yeah.
helpful if we could know at least who these people might be.
Yeah, okay, no, I'll definitely take back with my team, strategize on how we can do that. Because no, I agree, it's definitely important to know. I just don't know right now, or have an answer for you right now, but we'll be good. We're gonna be good. I'm gonna make sure, I know, please don't look at it.
I just have one question.
Sure.
So say somebody had cancer, they got this PCI, so then they beat cancer. Now in a year, because they beat the cancer, don't have any chronic condition anymore, so they lose those benefits.
They usually once they're qualified, they usually don't have to requalify if they're within the same plan. Again, I'm getting iffy, so I want to be sure.
So the hospital stays the same, they have to be in
Right.
the hospital and the managed care. Those two are the ones that-
Yeah, just one time. So last time it was 3 or more within 6 days. So I mean, it's a little bit easier, right? But still, it's, yeah, so. All right. Let's go into plans. I'm not gonna read through all the plans and give you, because I know you guys are like, all right, let's go, Jamie. So, all right, 7 plans. These are non-DSNPs. We're just talking about not the DSNP plans. I say non-DSNP. So 7 plans that are on our core plans. They are in our 48 county service area. So still the same 48 counties for these 7 plans. You can notice that they're on the top there, the low premium open PPO. And then you see the Wellcare Simples. Those were the no premiums, just changing to that simple name. So we have our new plan, it's our low premium open PPO plan. This plan has a $27 premium. Part C of that premium is filed at $20, and then Part D of that premium is filed at $7. So what does that mean? It means that if somebody has LIS, right, that's applicable to Part D, they could get their premium reduced down to $20 at most. So that's how it's filed internally. So because Part C is 20, Part D is 7. I just like to point that out to you guys. That's not going to be in enrollment materials, but this is like on the.
You'll have the LS sheet.
Yes, correct.
They have 75% LIS.
Just the key highlights with this plan. So it has an allowance of $120 a quarter for the Wellcare Spendables card. So that's just over-the-counter items. Again, it's quarterly. It does not roll over. For dental, it has a $4,000 allowance for comprehensive services, and that includes coverage for dentures, denture crowns, bridges. In network, you pay that $0 copay and have that dental allowance. Vision is set at a $500 eyewear allowance for this plan, and then the hearing is set at $2,000, so it's $1,000 per ear per year. On all the plans, or on the non-DSNP plans, you'll notice that there will be, of course, the RX deductible and tiers. On our assist plan, it is a $520 deductible, but on the rest of the plans, you'll see it's $420. So that's the highest you're going to see aside from our assist plan, which is at $520. So that's that RX deductible.
In network and out of network.
Oh,
Yeah, that's okay. I was doing the same thing too. Okay. Next is our low premium HMO POS option. Still have this right now in 2024, so again in 2025. This plan has a $16 premium. Again, Part C is filed at $9, Part D is filed at $7. So again, the lowest they can get this reduced with LIS is $9. Key highlights, the over-the-counter Wellcare Spendables is $72 a quarter. That's $288 on the year. Again, it does not roll over. The dental benefit is a $5,000 allowance with comprehensive dental services, of course, including coverage for dentures, denture crowns, bridges. And then one thing to know, I'm going to get annoying with this, but HMO POS. HMO POS. Anytime you see a plan that says HMO POS, the POS benefit for us for 2025 is only going to be applied for dental out of network. No medical, nothing like that for the HMO POS plans. Didn't see high utilization with members going out of network unless they were really on a PPO plan. And with Wellcare, we really, I would say we're pretty decent at dental. We have fairly high allowances. DentaQuest is our vendor, but we know we have issues with that network. So with this plan, members can go, we're on an HMO POS plan. Members can go out of network for dental, and they would be covered at a 25% cost share. That's out of network for dental on the HMO POS plans. On PPO plans, if they go out of network for dental, it would be a 50% cost share. So that's the benefit of having an HMO POS plan. So again, for dental only for 2025. These last two highlights on the vision and hearing. So vision for this plan is set at $400 for the allowance, and hearing is set at $1,500, so $750 per year. Here's our Wellcare Simple Open PPO plan. This is currently called our Wellcare No Premium Open PPO plan. So still a $0 premium, as you can see. Key highlights: allowance of spendable, so it's $77 a quarter that they can use for over-the-counter allowance. There is, for the dental, a $3,000 allowance for comprehensive dental services. It includes coverage for dentures, crowns, bridges. Vision is set at a $200 eyewear allowance. Hearing is set at $1,000, so that's $500 per year.
Do you think the formularies change, like the single medications, or switch over to?
I don't have the formularies yet. I try to snoop around too, and I can't find them. So, yeah.
Are you gonna walk our clients over to, from no premium to simple, because it's just a name change?
It's just a name change. So the contract code's the same. That when they get their ANOC, it'll say this is the name change, but you're still the same. So, yeah. This is our Wellcare Simple HMO POS plan. I like to call this the 026 plan. If you've been with us in the past, it was like the exclusive, I believe. This worked really well with Oak Street Health. So last year we didn't have enrollment materials for this plan, but last year we had so many people enroll in this that it's now considered one of our push plans. So this is what we consider a plan that is really positioned well in our market. You'll notice that a lot of the supplemental benefits have increased on this plan, and we did add transportation to it as well. So I see this plan being fairly competitive. When it comes to, again, I'll just do highlight the transportation. On some of our plans, you'll see non-emergency medical transportation. So this one has 24 one-way trips. For the Spendables card, it's $117 a quarter, so $468 on the year. For the dental benefit, it's a $3,000 allowance for that comprehensive dental services, including coverage for dentures. And again, because it's an HMO POS plan, it's only for dental, and it's a 25% cost share to go out of network.
What's no annual previous, man? There's no annual previous, man.
Oh, so on all of our dental plans, if you see an allowance on there, we do $0 copay on preventative services. So if a member has a $3,000 allowance, if they get preventative services, it's not going to eat away at this allowance. So that's what that means. I usually say that, but I forgot. Thank you. Couple things. Vision, couple things. $300 eyewear allowance, and hearing is $2,000, so $1,000 per year for that plan. So again, this was fairly popular this past year. We'll see kits for it and enrollment materials, marketing materials. So we're really excited to continue that. Next, we have our Wellcare Get Back HMO POS option. Again, the HMO POS is only for what? Dental. Woo! Okay. So, Get Back is $108.60. I believe it's $111, so I might have gone down a little bit. PCP is $0 in network. All of our plans have a $0 in network PCP copay. Dental, there's no allowance, but again, in network, $0 copay for their preventative services. If they go out of network, it's still 25% cost share. Vision benefits, there's an added $100 eyewear allowance. Hearing is only the routine exam. So really here, you're going to see the benefit being it to Get Back. All right, assist plan. This is our LIS-driven plan. So the premium is $16.20. This is the plan that they could get reduced down to $0. That whole premium on the back end is filed all as Part D. So that's how they can get it reduced down to $0 if they have LIS. And then just big call outs, OTC, they get $144 a quarter for the Spendables card. Again, it does not roll over. For the dental, they get a $3,000 allowance for dental services with dentures. Vision, $400 eyewear allowance, and hearing $3,000 allowance, so $1,500 per year. And then you'll notice this plan does have that RX deductible of $520. Yes.
Do any of the OTC benefits roll over on any of the plans?
Only on the decent.
Okay.
Yep, so any non-decent plan that's quarterly and it doesn't. The last thing before we get to the decent plans,
They have LIS, no dog.
yes. Patriot Give Back, open PPO plan, again, this is the MA only, no drug coverage. $100 give back, right now in 2024 it's at $75, so it did increase $25. Dental is set at $3,000, including denture coverage, so that $3,000 allowance. Vision is $300 IR allowance, and then the hearing is at $2,000, so $1,000 per year. So again, this is going to be that veteran-driven plan where they can use that money. All right, fun slide. So, decent plans. We'll have the 3 decent plans in 2025. Unfortunately, 11 counties we are exiting for our decent plans. So those 11 counties, I would say the most common in this lower part is going to be Eaton and Hingham. But again, if you have dual members in these areas, they'll be notified. Of course, we would, reevaluate their plan, see if Wellcare could be a good option. But if they're decent, of course, look at another carrier and make sure they're getting the most with what they need. So, Wellcare Dual Access Open PPO Decent Plan. So again, I really just want to focus on the expendables card so you guys understand this. So, and this is also, if you pick up our plan information, this is all written out just like that. I copy and pasted it. So, Wellcare expendables. So, there is a single allowance for over-the-counter benefits of $100 every month. Qualified members may receive an additional allowance of $82 for a total of $182 every month to use for OTC and then SSBCI. So let's say they're in this plan and they don't qualify for SSBCI. They would get $100 a month rolling that they could only use for OTC. They qualify for SSBCI, they get an additional $82, their total is now $182 a month, and they can use it however they want. They can use it all on gas, all on food, they don't have to split it up and do the OTC.
On your flyer that I got yesterday,
Yep.
it says $100 a month for OTC, but if they have SSBCI, then it's 82. So we don't. Well,
Then it's 182.
So it would be a total of 182 any way they want.
Yes.
Okay. Then the SSBCI, obviously, if they're a dual, they should just automatically get it.
I mean, I wouldn't tell them that they're automatically going to qualify, but you're most likely those numbers are going to be within those conditions. So, yes. Regardless of SSBCI qualification on the dual plans, the expendables does still roll over month. When it comes to supplemental benefits, you'll see on our decent plans, they kind of remain fairly similar, holding with the allowances. So, I'm just going to kind of go through these and let you know about the expendables, if that's okay. So we can. Okay. So Wellcare Dual Access HMO POS Decent Plan. HMO POS, it's only for dental. So again, for the Wellcare expendables, there's single allowance for over-the-counter benefits of $100 every month. Qualified members for SSBCI can receive an additional $43. So if they qualify, then it's now $143 a month, and they can use that however they like for those decent members. And then lastly, for our dual reserve, this is our partial decent plan. Right now it's called the all dual assure, but of course they're not all going to be dual, so we had to change the name. For this, single allowance of $68 every month. Now if they qualify for SSBC on this plan, there's no additional allowance added to that. It just opens it up to what they can use. So this plan would be still just $68 a month on the Wellcare expendables card. Cool? Alright, supplemental benefits. Key reminder, going into 2025, when it comes to their Wellcare expendables card, you will no longer be able to use your expendables card for dental, vision, and hearing services above their allowance. Right, so somebody, if they want to go on a network for dental, they could use your expendables card right now. Didn't, again, see high utilization in that. So when it comes to our expendables amounts, you'll see increases, but we did have to pull away this benefit of using that card. We did, however, add home improvement and safety items to the Spendables card that members can use. That is going to be administered and have that product list through Walmart. So members, they get the Healthy Benefits Plus app. That is the Spendables card app where members can view their card, view allowances, look up stores, all that stuff. So they'll have a link into their Healthy Benefits Plus app that goes to Walmart, and it'll have the pre-approved items. So that's stuff like non-slip floor coverings, air quality equipment, pest control sprays, and more.
But that's only if they have SSBC.
Yes.
Thank you.
Yep.
So, oh.
Amazon over-the-counter and healthy food. So in the Healthy Benefits Plus app, there's an external link that will take you to Amazon and how they shop. So they can shop for over-the-counter and certain healthy foods through Amazon. Again, they're not just going on Amazon and adding stuff to their cart. It'll be okay. There's Prime-enabled shipping, no $35 shipping minimum, and again, that's with Amazon. And then for Walmart, again, just to let you know, there is a $35 minimum order for free shipping. Yes.
Do they have to have a proper account?
No. Nope. They get Prime-enabled shipping. They don't have to have an account.
Your slide says there's no $35 shipping.
For Amazon. That's what I know. I should have said the Walmart one. No shipping minimum for Amazon, but for Walmart, there is 35. Uber Eats. No, this is not McDonald's. Taco Bell. Uber Eats. Thing about members who are in rural areas, they can use Uber Eats to get stuff delivered to their house for over-the-counter and healthy foods. Again, it's through the Healthy Benefits Plus app. Someone's not just going on Uber Eats and then putting their card in, but members can utilize that. And then lastly, for decent members, they can use their allowance to order mom's meals if they choose to do that. On the chronic meals? Yeah, so you won't see, at least in Michigan, any chronic meals benefit on our plans.
And it is coming.
Yeah. If they have the decent plan, they can order it. Then no, they wouldn't be able to use it. Yes. Really, when it comes to this line, this is our Spendables or Solutran network. Solutran's a vendor for Wellcare Spendables. That's a link up there to the Healthy Benefits Plus store locator. Simple, put in the zip code, you can find stores in your area. New for 2024-2025, we did add Sam's Club and Meijer. Meijer is not Myers. Whoever says that, that's annoying.
It's Myers.
Okay, Carrie.
You don't see that S?
Yes, it's silent.
Well, you know what? Maybe I gotta use that Wellcare Vision benefit and get some eyeglasses. Yes.
My client has a complaint on Dollar General using the card.
Okay.
The cashier would only let them buy one bottle of Pepsi and one candy bar at a time.
That's crazy.
Let's not know if
Yeah. All right, you can't read this. So, gold package is going to be our main package you'll see for allowances. So, 3,000, 4,000, 5,000. The dental packages, the way they work, they're all the same in terms of the cost shares. But again, gold, this is all the services that they're getting as a benefit for their plans. Yes, Karen?
On that previous one, does that include gas stations also? So does it tell you which gas stations you can go to?
I don't know.
Because I've had people say they can use that certain.
Okay.
The store just said that he also as a location that Wellcare or something.
Yeah, it seems like the gas stations themselves won't come up. But any gas, pay at the pump, they can go to. Pay at the pump, not inside. No, just Uber Eats, yep. All right, oh my God, you can't read this. So, for vision, any vision allowance, same package benefit. They can use their allowance to get Glasses, lenses and frames, just lenses, just frames, upgrades, contact lenses, however they want. They want to get all the contacts, they want to get 10 pairs of glasses, they can use their allowance however they want.
But they can no longer use the spendable card to pay towards upgrades, frames, or all that.
Yeah, correct. All right, the last time I say this. Oh my God, you can't read it. So, hearing, same thing when it comes to the benefit packages, right? They have a hearing allowance and they can use it for their hearing aids. They get the routine exam, they get the fitting and evaluation, then they have allowance they can use for the hearing aids. And then same thing when it comes to if they go out of network on a PPO plan, it would be a 40% cost share. Yes, all of our vendors are the same. Non-emergency medical transportation, just key reminders, plans will either have 12 or 24 one-way trips. It's a 75-mile radius. If they need to go farther out, have it make sense for them to apply for it. If you have someone in a rural area, it makes sense that they have to go 100 miles. We'll go through that approval process, and more than likely that would get approved. But this is through Uber, Lyft, they have their own ride share, and it's through Wellcare. Podiatry, only one of our plans has extra supplemental benefits. So other than the Medicare covered, so our dual access open PPO decent plan has 6 supplemental visits for podiatry. This is outside of what Medicare covers. So this is like extra. Yep. So 6 extra visits. Diabetic testing supplies, still the same thing as this year. One touches our vendor. They can get Dexcom or Freestyle Libre with a prior authorization. And that is a quantity limit of 1 meter per 365 days and 100 test strips per 25 days. So nothing has changed there.
It's for me, I don't care.
Part D, Express Scripts, they're still going to be our pharmacy benefits manager. So if you remember last year, it was a whole debacle. People were getting new cards and it was insane. So nothing's changed on the back end. Express Scripts is still managing the pharmacy side of things. Also, Express Scripts is our preferred mail order benefit. So members, if for tiers 1, 2, and 6, they can get a $0 copay or for a 100-day supply mailed to them. So that preferred is Express Scripts. Then also just want to let you know, when members get their evidence of coverage, they're also going to get this flyer of alternative covered drugs. Again, this is just drugs that have been removed from our formulary, common non-formulary drugs. And then members will get this. I'll find it and make sure Stephanie gets it, don't worry. But members will be getting this in their evidence of coverage. Community relations, hopefully you've all met Rick Howard. He's our community relations specialist. Jen, I know, does a lot of stuff, so I'm gonna not steal her thunder and what she does for you, but when it comes to community relations, Rick Howard is our specialist who goes out about the community, helps you get into places. So if you're interested, we have a training. It's a small PowerPoint that you go through. You fill out your agent profile when it comes to community events. So if you want more information, we can definitely talk about that more. And then a couple things. Who's done AHIP? Okay. So AHIP or NAVIP is what we accept for our Medicare certification. Once you've completed that, you're going to go to our annual certification training. All of this is located in Centene Workbench, so you don't have to go to an external link this year. You can connect that all in Centene Workbench. Once you do AHIP and the ACT training, you can now sign your 2025 contract that launched on September 3rd. Again, you can find that in Centene Workbench. Once you sign the contract, you are then fully ready to sell. So when you log into Centene Workbench, if there's a red X, that's probably why it's that contract. But again, it didn't open until the 5th of this month, or the 3rd of this month. So make sure you get that done. Broker portal. Really just the one thing I want to point out is that there's going to be an RFI status coming soon. So right now you might maybe get emails from our account manager, Karen, but when you submit an application, sometimes there's missing information, it'll go into an RFI status, request for more information. You have to reply or respond to that RFI within a certain amount of days, and otherwise they'll go into a rejected status. So coming soon, you'll be able to track that and send to the workbench. It'll say what plan has an RFI, the required information that they need, that you need to give them, the time frame, and how to resolve that. So I think that's really awesome to be able to track that in there. So coming soon for that. Once you're certified, you can order on September 30th. I know that's really late, 5 to 7 days, but we're starting to get materials in. I know we also placed an order for diversity, so we'll make sure you get you some stuff, but on the 30th you can order for 2025. This was just the last thing that I wanted to pull up. So community connections, if you're probably from the Meridian days, you know they did a lot of stuff like this. So the Community Connections Helpline is for members with those social determinants of health. You know, you're doing a lot, you're enrolling people, you're servicing your clients, but we know that some clients need extra stuff, and it's not necessarily your job, it's a lot of energy, and I know you care about them. So we have a Community Connections Helpline that they can call into, and let's say Ms. Smith has, you know, doesn't have a lot of clothes even. You kind of know she's dirty, she, you know, says she, you know, doesn't really have a lot of money. Well, instead of being like, hey, I'll take you to the store and we'll do all this, be like, hey, this is a resource that Wellcare has. You'll get connected to somebody that will help them look for those local stores. Same thing when it comes to food banks, you know, any of these kind of traditions. So if someone's kind of needs to learn more about hospice, maybe someone in their family is going towards that, have them call the Community Connections line. They can walk them through the process. So that's what that's there for. So please utilize it. Obviously, I know you guys like to help your members, but it can get overwhelming. So I would definitely suggest doing that. I'm going to send it to Stephanie, so she'll have it, yeah. But I think beautiful. That is it for me. Well, thank you. Thanks, everybody.